Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn, and return. I have learned a lot. I have earned a lot. Now it's the time to return a lot to the word. The discovery of Dr. Nasser. Since long I have been reading this. It is not always true that you are right and the rest of the world is wrong, but it may be true that you are right and the rest of the world is wrong. This led to the greatest discoveries of the world, which are now universal truths. This gave me encouragement. Why not? I can do this in my field, which I did in my 35-year of clinical experience. So, discovery of Dr. Nasser, I have already given the lectures, the glucopenic headache, woman's lip reality, tissue paper mania, new and the novel method of giving insulin, and today is the fifth lecture of this series, that is Piagi Syndrome, the other one, hypersmosiosis and hypophysiosis, will be coming soon. So, the Piagi Syndrome today, first of all, one should know that what is Piagi. Piagi in local language mean husband or the body. It is the disease of the female only. Age group of this disease is 40 to 45 years and seen in the married woman and the mother of 5 children mostly, and it appears in Asian women mostly also. The appearance of the symptom occur in a day at 4 to 5 p.m. mostly when the husband comes back from the job, and the symptoms are all vague symptoms, which I am going to tell you now. So, Piaget syndrome, in case of the gall bladder stones, we say it is the disease of 5F, that is female, fatty, fertile, 45 year of age, 5 children, or the female mother of 5. But here in Piaget syndrome, there is one more F. That one more F is for 5 p.m., where at which time the symptoms appear. So in this disease, patient present with 12 symptoms. One may have all the symptoms of or many of these symptoms in a patient. Patient will stress the intensity of the symptoms and will hesitate to go to the doctor for the medical checkup. Patient will not allow any of the laboratory test or the investigation done to prove those symptoms. Now, what are these symptoms which are the Piaget syndrome symptoms? Are number 1, backache, number 2, headache, number 3, tinnitus, number 4, vertigo, number 5 is asthenia, number 6, numbness of the body, number 7, hypotension, number 8, tachycardia, number 9, bradycardia, number 10, syncope, number 11, tremors, and number 12, change in gait. I am going to discuss all these symptoms one by one, and the first is the backache. As one can see, the female complain of severe backache, and she is just putting hands on the back and telling the intensity of the pain. And if we do get the following test, X-ray lumbosacral region, MRI or the CT scan, bone scan, blood test like uric acid level, vitamin D level, anti-CCP level, to root out the possible causes of the backache, and nerve studies like electromyography. All these imaging tests and the blood test are normal. So the number two symptom is headache, and one can just see the picture and tell that is telling the severe headache, and most of the time it is a kind of temporal headache, as one can see the female is putting hands on the temple and just showing the intensity of the headache. Headache, as you know, it is the pain in the head, so that is called headache. And just to rule out, we do the following test like X-ray sinus to see any sinus involvement, CT scan, MRI for any tumor in the brain, eye examination for the refraction, blood pressure checkup. High blood pressure causes the headache. Then EEG for any kind of brain abnormality, spinal tap for any kind of encephalitis, blood and urine analysis for diabetes, thyroid problems, and the infections. But all the imaging tests and the blood test here again are normal. Number three is tinnitus. Tinnitus means ringing in the ears or any sound which is just disturbing the ears, and one can hear the different kind of the sounds in the ear which are of no particular importance or any particular sound which can just fit into the medical term of tinnitus. And to rule out, we do the following test: X-ray both mastoid to see any involvement of the ear, hearing audiological test, movement imaging test like CT scan or MRI scan, lab test for anemia, thyroid problem, heart disease, or vitamin deficiency, which can prove any kind of the organic tinnitus in the body. But all the imaging tests and the blood tests are normal here again. Number four is the vertigo. Vertigo is the spinning movement of the head. One do feel as one is spinning or the things around you are spinning. So that is called subjective and objective. And these are the spinning movement which the female do complain like this. And to rule out, we do the following test: posturography, vestibular evoked myogenic potential, VEMP, hearing test, MRI and CT scan for any brain involvement, VN test, blood test like blood cell count, thyroid infection, blood sugar level, electrolytes, and any allergy test. But again, here all the imaging tests and the blood tests are normal. Whatever your heart says, the heart knows 1,000 ways to speak. Even with the animals, they know what your heart is speaking. The fifth symptom is asthenia. Asthenia generally means the feeling of weakness, lassitude, and to rule out, we do the following test: blood test, complete blood count, including vitamin B, folate, and ferritin level for any anemia, ESR, sedimentation, and CRP for any kind of infection in the body, biochemical test like blood glucose, serum electrolyte, liver function test, renal function test, thyroid function test, and vitamin D levels, autoantibody screen to rule out autoimmune disease in the body, then urine test to rule out diabetes, renal or the liver disease, and pregnancy. Other tests to rule out the asthenia are HIV testing, ECG testing, echocardiogram for the heart, tuberculin testing, and chest X-ray for TB, and urine toxicology screen for the substance abuse. If the patient have used any kind of drug, that can be also checked by the urine toxicology screening. But again, here all imaging tests and blood tests are normal. The next symptom, sixth, is numbness of the body, that one feel the different kind of the sensation or loss of the sensation of the different parts of the body. So that is called numbness of the body. Here again we do the following test: medical history of the patient, physical examination, testing by touch, temperature, reflexes, and muscle function to see the involvement of CNS, blood test like CBC for hemoglobin, vitamin B12, ferritin level, vitamin D level, serum calcium level, and again all the tests and the blood test of the different kinds are normal. Number 7 is hypotension. It means low blood pressure. Patient just do faint, and feeling of the faintness is because of the low blood pressure. We do the following test to rule out the real hypertension in the body, that we do check with the different BP apparatus like NRI, mercury or electronic BP apparatus. Other tests to determine cause of the low blood pressure are blood test, CBC, electrocardiogram or ECG, tilt table test, and again here all the tests and the blood tests are normal. Number 8 symptom is tachycardia. Tachycardia means increase in the heart rate. As one can see, the patient is saying and feeling the palpitation, the awareness of the heartbeat. The heartbeat is very fast as the patient is saying, so that is called tachycardia. And to rule out the possibility of the real tachycardia, we do the following test: troponin I and T to rule out the myocardial infarction or the heart attack, X-ray chest, ECG, echocardiogram, coronary angiogram, stress test, electrophysiology testing and mapping, Holter monitor, and event monitor to rule out the real increase in the heart rate. But again here, all imaging tests and the blood tests are normal. The 9th symptom is bradycardia. It means slow heartbeat, and the patient feel because of the slow heartbeat, the sinking heart, the fainting, and the patient is just blind and feeling that her heartbeat is very low and she's feeling also very low. Again, we do the following test here: blood test to rule out hypothyroidism, to diagnose sleep apnea, and ECG, Holter monitor, event recorder, tilt table test. But again here, all the imaging tests and the blood tests are normal. So the 10th symptom is syncope. That is the feeling of fainting, and sometimes the patient actually do faint, become unconscious, or just going to become unconscious. And to see whether it is true and bodily, we do the following test: heart and blood pressure, electrocardiogram, echocardiogram, exercise stress test, blood test, and tilt table test. But all these tests and imaging tests and the blood test are normal. 11th test symptom is tremor. That is just trembling and shaking of the hands, as one can feel, one can see the hands are trembling, and patient's arms are also trembling, the legs are trembling. So patient do feel that there are tremors in the hand and feet. And again, we do the following test to rule out the real possibility of some nervous involvement. So we do the neurological examination, tendon reflexes, muscle strength and the tone, and ability to feel certain sensation, posture and coordination, gait of the patient, and the laboratory test, blood and urine, thyroid disease, metabolic problem, drug side effect, and again all the imaging test and the blood test are normal. The 12th symptom is change in the gait, as one can see the patient, instead of standing on the two legs properly stand up, but just showing the limp on the one side and to show that the patient is unable to walk properly, and that is called the change in the gait. And to rule out the organic problem, we do the following test: X-ray lumbosacral region, MRI or CT scans, bone scan, bone test like uric acid level, vitamin D level, anti-CCP level to rule out any arthritis problem, nerve studies, electromyography, EMG. But again, here all the imaging tests and the blood tests are normal. Now, Piagi syndrome, previously it was considered fibromyalgia or HH. HH in local language is said to be the hard haram, that stand for HH. In local language, HH means lazy, non-willing worker, always tired without doing any job, and tired after getting job done from servants, not done any job physically herself, but getting the job from the servants, that also make that lady tired. And it is the basically this Piaget syndrome is the combination of pseudos. Pseudo means not real, false, just presenting the real, but actually they are not real. So these are called false, not true, or pseudo in medical language. So the patient had 12 pseudos: pseudo backache, no backache; pseudo headache, no headache; pseudo tinnitus, no tinnitus; pseudo vertigo, no vertigo; pseudo asthenia, no weakness; pseudo hypotension, blood pressure is normal; pseudo tachycardia, again heartbeat is normal; pseudo bradycardia, heartbeat is again normal; pseudo syncope, no fainting actually, just showing that she is going to have the syncope; pseudo tremor, no tremor; pseudo change in gait, and no change in gait; and pseudo numbness of the body. The body is okay, but the patient is showing numbness in the body. Now, there is no diagnosis for that. The only thing is diagnosis and treatment, as no definite medical test can diagnose it, as I have told in the individual slides about the different tests that can be done, but no test can prove it. So, husband can diagnose only by the three tests. That number one is ask the lady to be ready for a new restaurant for a dinner, or ask her to let us go for the shopping, just now be ready. And number three, let us go to see your mother or brother, and then going for the shopping and the dinner. Within 30 minutes, all the symptoms of the patient will disappear, which were looking very serious, and you will have your diagnosis of Piagi syndrome. So that is the end of the lecture. This is the unique in the sense that no one have ever touched this topic, and I am the only one who have discussed this topic, which is very common in Asian women. And I hope so that you will subscribe my channel and like and share it with others if you like it. And if you don't like, have any question, you just know, do not hesitate to tell me, please. And I am thankful to you for watching my